know who you are. I need you downstairs by 11 o'clock. I would also like to extend a warm welcome to my panelists, who I cannot do this without them. And if anyone has any questions, I'm the crazy person running around. Thank you very much. I'm so sorry. And of course, I forgot to introduce Dr. Millie, who will be sharing the panel discussion. Dr. Millie is the Director of Admissions at the Medical School of the University of Buffalo. And again, my welcome panelists. Thank you. Thank you very much. Thank you.
Thanks, Belinda. As you guys know, this takes a lot of work. And Belinda has done this for 7 years in a row, and it just gets bigger and better. So before she gets too far, just wanted to say thanks on behalf of all of us for putting this together. All right. So thanks, Belinda. Morning. Morning. Welcome. So good to have you all here. We have to be on our best behavior because they tell me that we're live streaming this thing. So we're all going to be on our best behavior today. But, you know, you're all here this morning to get important information. And we're really happy to see that you've taken the time out of your Saturday morning to come here and hear from us. So in all of this, information is key. You have to get the information from the right people. So that's what we're here to do this morning. We have 2 hours, which is really nice. So we have time to kind of give you some insights, lay the foundation, and get some questions from you. So as we get started again, my name is Dr. David Milling. I'm the Senior Associate Dean for Student and Academic Affairs at the Jacobs School of Medicine and Biomedical Sciences in Buffalo, New York. And I'm going to ask all of my panelists to introduce themselves. I am going to take the liberty after those introductions to call everyone by their first names. You're not allowed to do that. All right? But as we go along, hopefully you'll get to know people a little bit better. All right, Karen?
Okay. Good morning, future of medicine. Good morning. My name is Karen Reed Henn. I am Director of Diversity and Inclusion at Oakland University William Beaumont School of Medicine, located in Rochester, Michigan.
Good morning. I'm Nilda Soto, Assistant Dean for Diversity Enhancement at Albert Einstein College of Medicine, located in the Bronx.
My name is Ryan Booth, and I'm an admissions counselor for the West Virginia School of Osteopathic Medicine in Southern West Virginia.
Good morning. My name is Elizabeth Wilson-Anstey. I'm Assistant Dean for Diversity and Student Life at Weill Cornell Medical College here in New York City.
Good morning. My name is Jennifer Kimball. I'm the Director of Admissions at Vanderbilt University, located in Nashville, Tennessee. So I bring you warmth from the South because it's freezing here in New York. And also, thank you guys so much for being here. I heard it was your spring break. So thank you for taking the time to come to this.
Good morning. My name is Debbie Bisbee. I'm an admission recruiter for Lake Erie College of Osteopathic Medicine. We have 3 locations: Erie, Pennsylvania, Greensburg, Pennsylvania, and Bradenton, Florida.
Well, good morning. My name is Jonathan Cox. I'm the Associate Director of Admissions for the Philadelphia College of Osteopathic Medicine.
Good morning. My name is Paula Watkins. I'm the Assistant Dean for the School of Rowan University School of Osteopathic Medicine. We're right outside of Philadelphia.
All right, excellent. So I think the first thing that you guys will notice is that we have osteopathic medicine and allopathic medicine, right? And so let's start with Ryan. I know I didn't kind of prep him on this one, but we can start. If you can means what that looks like, and then we can have some of your colleagues join in as well.
Sure. So there are 2 branches of medical schools in the country. You have allopathic schools, and students there will carry the initials MD. Well, there's a second branch called osteopathic medicine, and students who graduate from those schools will carry the initials DO. They are separate but equal fields. Are licensed in all 50 states. And both fields can practice in DOs tend to focus on the whole person and not just, DOs also practice what's called osteopathic manipulation. And that is just a mix of different things using stretching, pressure and resistance to correct issues in the body and the musculoskeletal system.
So allopathic medicine also encompasses of individuals and families that they can provide care for rather than a specific area, or you transition, if you're a pediatrician, you transition into being a patient to internal medicine. The individuals, what you will do is, as you're going through your training, you're going to identify things that are areas or specialties that you feel very much drawn to. Whether it is, I like the challenge, or I like to work with this population. And so that you will have an opportunity to pursue that and provide care. We're also going to allopathic schools, will be trained to practice in the 50 states, and then also, places like Puerto Rico, who has 3 accredited medical schools. Down the road, by the way, and starting July of 2020, there's going to be one match for residencies with allopathic and osteopathic. There have been times that individuals have thought that possibly, osteopathic medicine was more in primary care, but if you choose that particular career path or that training, you're going to be entering the match with the students in allopathic school.
Thanks to all of you. I think that that's really a great point. What has happened over the years is that maybe 20 years ago, when there was a real separation between osteopathic medicine and allopathic medicine, these discussions were a lot more valid or important. Today, I think, just based on the last statement that Nilda made about the fact that starting next year, that 2020, that the match for residency is going to consist of both allopathic and osteopathic medicine. It shows that everything is coming together. So these are choices that you can make without worrying about how is this going to affect my life, right? The idea of manipulation is important for those of you who like that part of training a little bit more. I think that's an important distinction at this point. For the rest of it, the training is very comparable and it's not a concern, right? So I think that just in terms of setting the table, you should know that the information that you're getting from both sets of schools are comparable in terms of choices that you can have. All right. Okay, so we've decided to break things up for you into various parts of kind of the application process, so that you can hear from experts as to what you guys need to think about in terms of putting your best foot forward, planning, making sure that you're as prepared as you can be when it's time to send in your application. Just so we get a sense of the room, do we have any freshmen in the room? Awesome. Wow, that's great. Sophomores, excellent. Who are our juniors? Good, good. Seniors? All right, good. Do we have any post-bac students in the room? Excellent, 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 good. So we're going to take care of all of you today, right? So we're good for that. I'm going to ask Karen to start off for me and talk about what courses are important for you to pay special attention to. Not all are important, but which ones are very important, and then how to look at things like GPA as you're going through that process.
Okay, so first of all, please recognize that you don't necessarily have to go into a science major in order for you to apply to a medical school. You are able to major in anything as long as you are aware that you still have to complete the prerequisites for medical school. And now with the way that the AAMC is looking at both students and student GPAs, they also want to be sure that students are coming in well-rounded. Okay, so making sure that you're taking some social sciences, making sure that you are actually able to engage with people, okay, as opposed to just the hard sciences, because you need those soft skills as well as your sciences. That being said, when you are thinking about how you're structuring your classes and the pace that you're taking, some things that I've told some students that I've worked with is to be sure that as you're taking certain science classes that you're actually progressing in those classes as opposed to just taking the basic level. Because a lot of schools tend to want to see that you are still being academically challenged as you're moving through your education. Something else you also have to consider is where your strengths and your weaknesses are in terms of the kinds of classes that you take. So at the first sign of trouble, it's important for you to please seek out some help. Like, do not wait until midterms have come and gone to then identify I need extra help in these subjects. So the earlier that you get help for yourselves, the better. In terms of at least my admissions committee, things that they look at very strongly is that they look at your biology, your chemistry, your physics, and your mathematics. It's called BCPM. And they want to see that you have that solid foundation because you're still going to be doing those things when you're in medical school. Like, you don't come in and start giving shots. Like, they want to know that you can actually still manage the scientific foundations of medicine before actually moving on and learning about the body.
Excellent. Thanks, Karen. Anybody want to add on to that? I would just say that as you're going through your course planning, I think that what Karen said in terms of those core courses is really important that, for better or for worse, organic chemistry is still a huge marker as terms of a gateway course that medical schools look at. So you have to do well in all of them, but organic still stands out there a little bit. I'd also say to you that, we're going to talk about the MCAT next. And as things have changed over the last few years, one of the things that's on the MCAT is biochemistry, right? So you can't go into this process not having done biochemistry. So it blows my mind when I talk to people and we talk about, so how can, who may have had a challenge on an MCAT exam and we talk about, well, where are you in your courses? And they'll say to me, well, I'm doing biochemistry next semester. And I'm said, but you just did your MCAT. So that's on the exam. How does that work? Right? So you need to be able to have good counseling in terms of how to put this together, right? Of course, you have to do some statistics because stats is a part of this. Most of you will cover some of that in psych, but it would be nice if you did a little bit of that. And a little bit of ethics in medicine is important, just in the way that they talk about how these cases are written and what you're expected to do in terms of critical thinking. It just helps, right? To having done some of those. Sure.
Be wary of repeating courses over and over again. So AMCAS, they will average all of those course grades together. But be mindful of just how you're doing. So if you know that taking biochemistry, for example, in order to pass, you need a C, but in order to be competitive, you recognize that you have to be doing better than a C. However, you cannot continue to take the class over and over and over again because it will just cement that C for you. So just be cognizant of how many times you're trying to repeat a course or find other ways of which to improve your standing. So when you take the MCAT and you look at your scores, not to jump ahead on that, but once you recognize where your weakness is, then you'll know where you need to do the work.
Okay, excellent. Nilda, you had something?
I was in part to let you know that repeating courses, AMPAS is going to average both of those grades in. I sometimes get a call and say, oh, AMPAS, when they verified my application, made a mistake, and my science GPA is higher, and 99% of the time, the student is accustomed to your undergraduate school is only going to give you credit for one of the courses, not both. And so typically it's the second grade, in which, it's usually better. The tip also that, if you're on the fence as to whether or not you need to repeat a course, unless in part it is required by your institution, either because of your major or your GPA, that you have to repeat that organic one again, then you have to repeat it. We would rather see you move on and do organic 2 and do biochemistry, because if you're going to repeat organic 1, you're sitting through it twice. So you better get a B plus A. You've already saw that material. Now, it may sound a little counterintuitive if you got that C and you're saying, oh, wow, but you're saying move on and take more advanced courses, is you have to stop and reflect. All right? Why did you get that C? Are you a procrastinator? Are you maximizing on office hours, tutoring? Are you going on Khan Academy and looking up possible questions to answer on the topic? I mean, be reflective as to why you did that. Maybe you're spreading yourself too thin. You're pledging, you're running a club, you're doing this, that, and the other. Well, that's sort of nice, but we're going to be more impressed in your courses than your extracurriculars. So you bear that in mind when you think, well, how would I do if I just got to see it moving on? So.
Liz?
Yeah, I wanted to piggyback on something that Nelda said also. As students, I would say try, you'd like to be the most competitive applicant for medical school that you can be. Okay, this is your journey, right? There's some ways to do that when it comes to classwork. I would say definitely read the material before you get to your class, right? Because once you get to your class, then you'll be having a conversation with the professor. In order to get that GPA, it's like every assignment counts, every exam counts. So hit the ground running, right? You go to those office hours. Very, very important. Very important. Get to know the professors. Get a sense of how they test, right? So I would strongly urge that you pay attention to those things as well, and spending time on the little details, because that will build into a GPA.
Excellent.
Hi, I'd like to add one more thing. Since the majority of you are already seniors or post-bac students, you might be sitting here kind of concerned about what happened your freshman year. You can't erase your freshman year. We see it. We're looking at performance trends, okay? So if you're sitting here as a senior and you're going, I did make that C in Orgo and I took it again and made another C, I guess med school's off the table for me. I should just leave this panel right now. No, okay? Because, I'm probably speaking for all of our committees. We're human. Our committee members are very diverse. Some of them were late bloomers. They were overengaged when they were undergrads, did post-bac, made the grades, got into medical school, finished residency, and are now sitting on our admissions committee, okay? So they recognize that not everybody came out of the gate at 18 years old and made the right choice every day, every time, made all A's 4.0. So please take that pressure off of yourself at 10 o'clock on a Saturday morning, that we recognize that, okay? But freshmen and sophomores in the room, don't use that as a free pass and go, well, Jen Kimball told me I didn't have to work very hard. please recognize, like I said, we look at performance trends, okay? We look at the post-bac work if you guys need to do that. When we're looking at your academic profile, we don't just look at a GPA. If we did, my job would be so easy because I would just go, oh, well, here's a 4.0, except here's a 2.1 decline, kind of thing, right? But we look at everything. We triangulate. We look at performance trends, your major, how many hours you were carrying, and we also look at what you were balancing with that. Some of our students work full time. Some of our students are the primary income maker in their household. And it's not fair to compare somebody like that's GPA with somebody who didn't have those kind of additional responsibilities. So please recognize that we look at everything when we're looking at an academic profile for a candidate.
Excellent. Good. All right. So everybody's good? All right.
I actually had a question for the board.
Can we do the questions at the end?
Yeah, of course. Sorry.
Write it down.
So yeah, don't forget. All right. All right. So we're everybody's good with GPA and courses for right now. Keep those questions until later, but for right now, and don't, as Jen said, don't let the imposter syndrome sneak in here, right? We're not into that here today, right? We're here to move you forward. So that's a great point. All right, so we're going to talk about the other amazing things that you guys just love, the MCAT. Right? All right, and so that I think we just have to take the bull by the horns right at the beginning, get it out of the way, and then we can relax. Anxiety levels can go down, and we can talk about other things. All right. So, Ryan, I think you pulled the short straw here. All right. So we're gonna do MCAT.
Okay. So the MCAT, that is the entrance exam, obviously, for both DOs and MD students. So you have to take it.
Drop mic.
Now, so one of my first tips for you, prepare for that test so you only have to take it once. It is very common that students have to take it more than once. So if you do get a score that you're not happy with, don't get too discouraged because a lot of students have to retake it. So prepare for the test. So as stated earlier, you want to make sure you take in chemistry, biology, biochemistry. You want to have those courses under your belt before you take the MCAT. Some students have told me, oh, I took it during my sophomore year just to get it done, get it over with. And but I didn't take chemistry. I didn't take biochemistry. I don't know why I scored in the 20th percentile. So the scoring on the test, so there's 4 sections. And they rate your skills in your biology, chemistry, behavioral sciences, knowledge. There's also a critical reasoning section to assess your critical analysis skills. An average score on each of those sections is a 125. So let's say you get a 125 on every section, you have scored a 500. That is the national average. So a low score being 472, the highest score being a 528. Most schools will not look at you if you're below a 500. In fact, you really want to score above a 500 and be above the 50th percentile. It is common for students to take the MCAT before they graduate college. A lot of students try to do this by senior year. Usually by then you've taken those courses that you need, hopefully. But this is not a requirement. If you want to matriculate right into medical school after you graduate, then yes, you're going to want to take that MCAT before you graduate. But a lot of students are starting to want to take off a year and do some other things. And some students wait till then to do the MCAT. Now that's just up to your particular situation, but it is common to try to take that test before you graduate because schools, generally speaking, accept students for the next year. Does that make sense? So this summer, DO students are going to be applying to schools, and if they're accepted, it won't be until next fall. So that's why timing is very important, depending on when it is you're wanting to go to med school. There is a fee for the MCAT. It's over $300. So again, take it once and then let that be the end of it. Really prepare. There's a lot of prep courses that you can take. Kaplan and Princeton Review. There's so many. So it's also a really good idea to take a full-length practice to get yourself ready for that beast of a test. I mean, it's an all-day event. So I really encourage you to take a practice test or more than one. Because if you do that, you'll definitely be ready for the test. If you've taken all the courses that you need,
Success. It's something called the academic index score, and please come to my table if you're interested in using that. It's offered to people who score less than the 40th percentile or perhaps have not taken the MCAT at all, combining ACT and SAT scores from high school along with your cumulative college GPA.
Excellent. All right.
Can I add one thing? Vanderbilt is a little bit different than a lot of other medical schools. We encourage you to be one and done with the MCAT because it's, to quote Ryan, it's a beast. But sometimes you kind of have an off day. We actually will super score your MCAT. So if you take your MCAT twice, we'll take the highest from each attempt. And this is because our committee members, some of them also had to take the MCAT more than once. And they said, gosh, I wish medical schools did that when I applied. And so we changed the rules. So we will super score your MCAT because we recognize you did great in that section, you know, maybe the car section the first time you took it. And then when you retook it, you said, hey, I've got cars in the bank. I'm good with that. I'm going to focus on the other three sections. And when you took it again, you didn't do so hot in cars because you paid no attention to that, but you rocked it in the other three sections. So we do super score your MCAT. The other thing I do want to add, and just in case you know, I used to be a pre-med advisor in my former life. So I advised students for 14 years. So I tend to be very loquacious when I do advising and panels and stuff, so I apologize. But with the MCAT, you need to remember rolling admissions for medical schools, okay? So when you look at the dates of when to take the MCAT, when it comes out, you go, hey, I've got all the way from January to September to take this nasty test. September looks real good. Let me push that off as long as possible. Well, remember, on our committees, we start looking at applications come July, and it takes 30 days for your scores to come in. So if you take that September test, we won't get your scores until October. By then, we've given up so many of our interview spots. You better have made like a 528. I mean, they need to use your MCAT as the score, you know, to compare other grades and stuff. Like you need to have like the answer key in order to make it to the interview if you take it for the first time in September. When I advise students, I used to say your MCAT is kind of like a traffic light. Green is taking it all the, like if you want to matriculate the following year. So green would be taking it all the way to the beginning of July. Yellow is taking the MCAT for the first time in July. Red is kind of August and September. But, you know, you don't make it a practice to run around and run red lights, you know, but you have probably at one time or another. There are going to be people, you'll have classmates that'll say, well, I took the MCAT in August and I got into med school. That girl didn't know what she was talking about on that panel. But those are not the norms, okay? So you want to kind of hedge your bets and take that MCAT sooner rather than later. But every attempt you make on the MCAT is automatically reported. So don't take it for kicks and giggles just to say, well, let's just see how I'm going to perform this year. You want to be on top of your game. The MCAT is a marathon. It's not a sprint. You're probably a great sprint runner. The marathon is sitting in a chair all day. So you have to have that same, you know, energy and strength at the end of the day as you did when you came in and answered question number one.
All right. Good. Karen.
So just to kind of add to that, the cost of the MCAT can really be prohibitive. So that's why it's important for you to check out the fee assistance program. It reduces the amount from $310 to $120 because we can manage $120, right? And it does come with the actual MCAT. the official guide to the MCAT, 2 practice exams, which I highly recommend that students take because you have to get comfortable with sitting in a seat all day.
Yes.
Okay,
Preach.
very important. Using the study guides, utilizing the MSAR, 16 applications to medical school. So it actually increases the number from 10 to 16 for students. And most, if you are a part of the fee assistance program, the fee for the secondary application will get waived. For some, it's all dependent per school. So that's something to definitely take a look at.
So I just want to give the alternative view for one thing, right? So, I think what Jennifer said in terms of big picture is really important. I would just say to you that if you sign up to do the MCAT in April and you're saying, I need to get this done by April because my application needs to be in so that I'm considered early, and you're not ready in April, do not take the
I
exam,
agree. Absolutely.
right? So I'd much rather you spend, I think I'm speaking for everybody,
Yes.
that you spent the extra time to make sure you're ready for this exam. In my experience, I don't know how this is for everybody else, but I certainly believe that as we have spoken about the challenges sometimes that courses and GPAs may present, your MCAT is actually an opportunity for people to take a different look at you. And so, in some cases, I believe that that exam is as important as your 4 years of undergrad. And so, if you need to spend that time to do it and get it right, it's well worth it, right? So that's what I would say with regards to that.
So, two things. One, you mentioned that if you're taking or you slated that you're going to take this MCAT in April, the spring sort of, it starts from January through September, when you can take the exam. If you decide that you're going to take the MCAT while you're taking courses that spring, mentally and physically tell yourself you have just registered for an additional 4 credits. Because you're going to have to set aside time to review stuff you haven't seen in 2 or 3 years. That basic biology, that general chemistry, and so forth, while taking your courses. In the old days, because I've been at this, some of us, a long time, and it was only an April and August exam, the students who took it in April were juggling right after midterms and just before finals. Because think about it, if you're sitting for the exam today, when is your finals this semester? So students were juggling, and if you're going to take it, you're going to be juggling something is going to end up in the back burner. Or you can manipulate that spring semester that you're not taking calculus 3, physics 8, and the literature of great thinkers. Okay.
Great books.
So maybe you're taking modern dance and basket weaving, and then you're studying for the MCAT. So bear that in mind that you've added on and added 4 credits at minimum. The other thing is there is a way that when you apply, only when you apply for the MCAT, you can ask to be included in the minority student registry. If you are an underrepresented minority, if you are someone who are socially and economically disadvantaged, you can be asked to be part of the registry. And what happens is that when for each exam, okay, so if you might have a register for the MINTMAR, and I said I took it in April, I'm going to take it in June, I already am part of the MINTMAR. No, it's for every application, and it's only at the time that you're applying for the MCAT. So what happens is that some medical schools use the MINTMAR and will say go to the registry and says, we're interested in, let's say I'm one of the state schools in New York. I'm a SUNY school, and I want to know all New York State residents who scored 505 on the MCAT. And the school gets a roster. All we're getting is your name, your contact information, your undergraduate school, and the MCAT score. We don't know your GPA. We don't know if you've done research. We don't know anything else about you. But what you may get is that you may get information primarily in emails saying, hey, check us out. We saw your MCAT. we feel that you're within our range. You know, our school offers all these great opportunities. Why don't you look into us? And you may get contacted of schools that you would never have considered. You know, whether you're going to be thinking, wow, Vanderbilt, where is Vanderbilt? Do I want to go to Nashville or where is that place? So that's a way to let institutions know that you are a diversity student, and the schools that use it have a way to reach out to you and let you know, hey, look into us as a, you know, as a school that you're applying to.
Excellent. So, two other things. I think Debbie mentioned that there's an alternative pathway apart from the MCAT here. Don't get too excited. All right, but I think it's definitely worth hearing more about that in the session. So if you need to, Debbie, one more thing. What's that called?
Pardon me, it's called the Academic Index Score.
Okay, so you should certainly at least hear what that's about. A little bit more transparency, right? I think you all wonder. So this is one of the questions that I get. So tell me, what is the minimum GPA and the minimum MCAT for your school, right? And it's one of the things that I actually will roll my eye in front of you, right? So because it's an interesting question. I know where you're going with it. I'd frame it for you in a different way, just in terms. Have a fair idea, especially when it comes to the MCAT, above and below what level a student in our curriculum will be successful in the MCAT, right? So if you don't need a five, what was the highest score is? 528, right? You don't need a 528 to become a doctor, right? And then the lowest was a 472. However, you do need a 490 to do well in whichever curriculum it is, right? So if you have a 470 something,
Time to have a conversation.
there you go, right? So but this is kind of, you know, how we look at things. So that's important for you to understand as well. All right, so we got those two out of the way. GPA, MCAT. Let's talk about, well, not yet fun, but a little bit more. We're going back to Nilda again. She's going to help us talk about the AMCAS now that you're getting ready to apply. What does that look like?
Well, yeah, I'm going to focus on your personal statement and then one of the questions in the MCAS that you'll be asked. So we have people who are educated, they're seniors and some post-backs. How many of you have written your personal statement? Oh, wow, good. How long did it take you?
7 months.
Good, yeah.
Okay.
What happened? 2 or 3 months? Who else? A year. Yeah. Okay. So the rest of you, you're wondering, what are they talking about? 7 months, a year? I mean, what's up with that? You know? All right. The reason I ask people who have actually done this, okay, that you don't in your head think, oh, I'm going to apply to AMCAS. The application goes live. You can start in April. The application goes live in June. And over the weekend, the Memorial Day weekend, I'm going to do my AMCAS application. And that includes my personal statement. Okay?
No, I tell you now.
No. Of everything that you enter electronically, the personal statement is what's going to take you the longest. Okay? The other stuff, and you're going to have to keep certain records, but the other stuff, you know, you list all the courses you've ever taken, the grades. You're going to be asked in an activity section, you're going to be asked, where is it that you have either worked and have awards and so forth. I'll touch on that a little bit. So you think, oh, okay, this is something to knock off. This is the one thing in this application you really have full control over. right? Your courses are your courses, the letters of recommendation, the other people write, the MCAT that tests some, whatever. This is what you have control over. And what you're using that space for, or should be using that space for, is to tell your story, your journey. What sets you apart? Where is your passion? When I see people one-on-one in my office, and you're welcome to do that, one of the questions that I ask, and I ask it in this way: why do you need to be a physician? Not why you want to be a physician. Why do you need to be a physician? Why is it that this is your calling? This is what you're trying to convey in finite space. Because the other challenge is going to be that you can write 3 chapters on your life and your journey. Okay. You're not going to have that space. All right. So, in that succinct area, you have to say who you are. We are not looking for a movie or a television script for Grey's Anatomy or whatever, that you were there and the ambulance came in and the doors flung open and the gurney and the blood is gushing no, that's not what we're looking for. No. All right. Again.
I'm sorry, Nilda. Really? I thought that was exactly what we're. No, go ahead. Sorry.
Yeah, well, that's true too. You have to read people reading hundreds of these. Okay. But going back to you, so you're going to have to self-reflect. What makes you unique? What are the things? What is this journey you? What have you sensed, and why you want to be or need to be a physician? Because maybe you yourself haven't been exposed to, whether it's family or others, that lack of adequate health care. Having all sorts of challenges and health disparities, and you see that your calling is to make a difference. That maybe you have been in. I see how many mentoring and medicine shirts are out there, and unfortunately, I've been a lot in. Excuse me. Monty's emergency room with my sister, and seeing some of you guys. So you may have seen the blood gushing and whatever, but you need to tone it down. What was it about that experience that really maybe cemented for you that this is what you want to be, that you need to be? And so in terms of, one of the words we haven't used yet has been holistic admissions. And so that is your journey again. Whether we're looking at, and we're using other measures in terms of admissions outside of just your coursework, maybe it was that SAT and other things that you've done, but we're looking at you comprehensively. And so this is your opportunity to talk about who you are and what got you to this point. What you should not also be doing besides the script, you should not be giving us a rundown what you did by semester, employment, awards, or whatever, because you're going to have an opportunity in the application and different section to list 15 activities. It could be activities includes work, research, summer programs, awards. You've been done a poster, an abstract was selected. You have a leadership position in some sort of club. Also will be given, you can decide 3 of those 15 are major significant about you. And you want that screener to know this is a significant factor. All right. Maybe I got an abstract selected, or maybe my sorority, we launched working with young girls and trying to get them to finish high school or whatever it is and you will have additional space. You have 3 opportunities to give additional space to bring to the reader, the screener. Oh, this is significant. This is like a red flag. Listen, pay attention to this section of who I am because that's significant, which frees you up from putting it into your personal statement. Now, you may have had, again, some sort of an experience that gelled for you. confirm for you this particular career choice, and you may be, you may expand on it a little bit there. But the details as to dates and times and some of that, that's already, in another section of the application, right? The last person, you should have multiple readers, whether it is the pre-med advisor, maybe you have mentors, maybe you have researchers, various people, and ask them, how does this sound? What is the voice that you're getting? What is it that you're learning about me? Because the people who are reading this probably have never met you. So, that person that you're asking to read it for you may know a little bit about you and says, well, you could have explained a little bit better this here, it's a little vague, and I know that you did it this way or that way, or something that they can point out. And the last reader should be someone who has a good editorial English teacher type of thing that could make sure that you're not doing run-on sentences, that things are not awkward. I know that in this journey of 7 months, a year, whatever, I mean, people who probably wrote, I don't know, 10, 12 drafts, and when you get back to it and it says, oh no, I don't like that, or let me move this ahead or later, that kind of a thing. The question that you will be asked that I mentioned earlier in the application is, you'll be asked, do you consider yourself to be disadvantaged? AMCAS has a very vague, intentionally vague explanation. What does that mean, am I disadvantaged? The explanation I was given when they first entered this application was they did want to dictate what kind of things you can include in that area. If you say yes, then you get a drop-down box and you can explain why you consider yourself to be disadvantaged. Now, you could be disadvantaged in a number of ways. Sometimes we're very private, and sometimes, it's awkward to share with people, to say, my family's been homeless. My family, we have not had, steady income. People have been laid off out of work. And so that may be part of what, you have experienced. A few times, some of you may also have had to leave your families because they were so dysfunctional. You could no longer function in there, and as a result, you moved around a bit, whether it was relatives or family, that kind of a thing. And so that may be something that, that gives you an opportunity. So when a screener looks at what you've done, okay, and knows that you've been homeless, that you've been working, you worked so that you can help support your family, even though you're listing it that I worked, and it could be in the supermarket, we're not going to have a value judgment. Why aren't you in a research lab? So that gives us an insight on some of the struggles that you have overcome, some of the barriers you've overcome, and look what you have succeeded and what you've been able to accomplish. My last comment to you is this. Anything you put in your application, whether it's in your personal statement, whether it's your disadvantage statement or your activities, is open for discussion. Be prepared. If someone will ask, oh, I saw that, how did your family resolve their housing situation? Or how did this, did you overcome this or that? So just be aware of that if you put it down, that someone could ask you further clarification or explanation about something that's there. And if you feel very uncomfortable and discussing something, then I suggest that you consider not including it.
Excellent. That's really helpful. I know Nilda said this kind of around the way, so I'm going to make it really explicit. Use spell check, right? It's having someone with editorial experience read it. That's one way of saying it. Use spell check. All right. And remember that spell check can autocorrect to things that you really don't want, right? So you need to really, I can tell you, that's one of the biggest turnoffs for all of us who have to read so many of these documents, that you start to read this and there are spelling mistakes throughout it that to me, that just means that you haven't spent the time to make sure that this was a clean document. All right. So that's a kiss at death right there. All right. Sure.
Please don't be afraid of constructive criticism when it comes to your personal statement. So it will not help you to give it to someone who likes you because they will, of course, say that it's fantastic. You want to give it to someone who is going to really have a critical eye and ask lots of questions and ask for lots of clarification so that we can get it down to the heart of the matter with your writing.
All right. Excellent. Good. Uh, time is flying. We have a lot to cover. So we're going to keep it moving here. So, Paula, you've been really quiet so far. So you're on stage for letters of recommendation.
But I did want to add, as Nilda said, that she described AMCAS. She did a phenomenal job of explaining to you about the application process for AMCAS. But for osteopathic medical schools, you're going to apply through ACOMAS, and it's exactly the same requirement. And so we're going to be looking at you the same way, and there are the same requirements, your personal statement, disadvantaged statement as well. So we ask you to deliberate and take your time filling out that application. But I forget who said, I think maybe also Nilda, that letters of recommendation are also under your control. Who writes them for you is significant. And so you want to make sure that you are establishing relationships with people who are going to write these letters of recommendation. You know, we read them. They do get read. They are a significant part of your application, and they're also part of your journey. So in addition to your ability to do well academically, some of these people that you establish relationships with are your professors or your mentors have maybe understood your journey or shared your journey, or you shared the journey with them. And so they have an opportunity to describe who you are. I always tell students, you know, when you're thinking about your application, you need to wear an admissions hat, because sometimes the things that are being described about you are helping us to determine long-term what kind of physician could you possibly be. How compassionate are you? How determined are you? How much do you overcome? Your letters of recommendation from your faculty may talk about how you started out weak in the class, but based on the relationship you established with them, you went to office hours, you were in a study group, you did tutoring, you took initiative, you were determined you were going to overcome some of those issues. That may be something they write in a letter of recommendation. One of the things you also want to do is to ensure that whoever is writing your letter of recommendation can write you a strong letter of recommendation. Or that basic science faculty or the researcher is someone that's well known. The letter of recommendation is not about them. It's about you. And so we don't care, in all honesty, you know, who they are and how long they've been practicing or doing what have you. It is really about you and what they can say about you. And so you want to make sure that you've established relationships with people who understand your journey. And that comes from establishing relationships and not being afraid. So you're walking up to someone or you're telling them, you know, in the next year or so, I'd like to apply to medical school. Or I'd like to apply to dental school, wherever you're going. And so as a result, you know, here's my story, you know, and they may be willing to assist you. Could be another physician who's going to tell you their story, and they take an interest in you. And now you're in a relationship and that person's championing your cause. So now over time, they see either your struggles or your successes or both and can attest to that. And as you've heard, we understand that some students have to work, that we're looking at your grades. And so, you know, there's some consideration for some of the things that you maybe have had to overcome. And as a result, having that explanation is great. And so we're interested in that. We want to know how resilient you are, you know, what you're willing to do to become a physician and what kind of personality you have. Are you someone that, you know, we could actually see, you know, we could put before patients? So that's very, very important. So I would encourage you to start establishing relationships. For those you said you were freshmen and sophomore, your juniors, You can get letters of recommendation from others that you've worked with. I see one of the points here was that, the role of the committee letter. I will tell you that medical school admissions people make relationships or establish relationships with all your pre-med advisors. So we know who has a committee letter and who doesn't. So if you happen to be coming from an institution where there's a committee letter and you don't have one, we're going to wonder why. It's up to the school to decide whether or not they think that letter is important. So we all have different ways that we look at those letters of recommendation, but we encourage you obviously to attempt to get that committee letter because that's obviously an important part of the process. Okay, so I think
That's excellent.
I just want to add one thing. And if you get a copy of the MSAR, the Medical School Admissions Requirement Book, it will tell you what medical schools require what combinations of letters of recommendation. And so if you don't have that combination, your file is incomplete, therefore you can't move forward. Schools like Vanderbilt, we just encourage you to have letters that follow the AAMC letter evaluation guidelines, letters that discuss your interpersonal, your intrapersonal, your thinking and reasoning, and your science competencies. If you've done research, we expect to see a letter from your PI. When you ask for a letter of recommendation, give them a copy of your resume, your transcripts, any supporting information that you can, because I know it feels awkward to impose yourself to say, hey, Dr. Smith, can you please help me get into medical school? Heads up, all of your faculty know that they're probably going to have to write letters of recommendation for their students. That's part and parcel of being a faculty member on a college campus. When I taught at the undergraduate campus, I wrote letters of recommendation. It's just what we do. So you're not imposing. Give them as much ammunition as you can so that they can write a strong letter of support for your candidacy.
And what so many people have said to you about how do you do that? How do you establish those relationships? Making use of office hours is a great way to start, right? And that's how you begin to have someone get to know who you are. If you're in a general chemistry class or an organic class with 300 people and you get an A in that class and you say, boy, maybe I can get a letter from this person, I can tell you what those letters read because we've all read 500 of them, right? It says that Nilda Soto was a student in my organic chemistry class. She did well on all her exams. She got an A in my course, which means that she's in the top 10% of the students in my class who took this course. We wish her well in medical school, right? So that tells none of us anything about all the wonderful things who you are, right? So I think that those establishing relationships through things like office hours, presenting someone with a transcript, a CV, even a personal statement, right? For them to get a better sense of who you are, right? And then having them put together a strong letter for you. And then you need to ask the question because some of your professors will actually say to you, when you say, are you comfortable writing me a strong letter of recommendation for medical school? And they say to you, well, maybe you should look for somebody else. And that's a great thing, right? You should never take that as a rebuke. That's a good thing because you don't want that person to write you a letter that's not a strong letter, right? So,
and give them plenty of time to write it, because they're writing letters for a lot of people and faculty members get busy. They've got kids' birthday parties. They've got conferences that they're attending and stuff like that. So it's your responsibility to stay on it. So historically, I'd recommend for students usually start getting letters like February, March timeframe so that they can be in their file ready to send out at the beginning of the cycle. I don't know how your school handles it, so that was how I handled it when I was an advisor. But just make sure that you're staying on top of it with that.
All right, good. Moving on. I know there are lots of interesting questions and
The point 3 of the letters.
yes. So yeah, so remember also that you have to waive your right to see the letter, right? So if you don't waive your right to see the letter, we wonder why, right? So So you have to have faith in the fact that the people that you're asking to write your letters, once we have gone through this process, are going to write good letters for you, right? And so you have to waive your right. That's an expectation. All right, good. I know you all have lots of things swirling, so write them down. We're going to have some time for questions. So looking forward to hearing from you. But before we get there, Liz, you want to talk to us a little bit about research and extracurricular activities?
Surely. How many of you have done research?
Nice.
Fantastic. Okay. How many of you have not done research? Okay. You're entering a field, a career that asks questions, goes about trying to answer those questions. Invariably, it's through research. It could be in basic science, in a laboratory setting, or in a clinical setting, right? So for those who have not done researches yet, I urge you to get into some sort of research before you apply to medical school. All medical schools don't require it, but it's encouraged, right, that you do it. Now, where do you get the opportunity to do research? One would ask. It could be while you're a student, asking your professors. They are doing research on campus. Ask them if you can join their lab, or it could be some sort of qualitative research in one of the social sciences, right? Ask them if you could be part of their study. If for some reason your schoolwork, your classwork don't lend itself to you having that space to do it during the school year, I would suggest doing research over the summer or a couple of summers, right? So as you go through this whole process, you should have a map from freshman year and beyond. I wouldn't say senior year because some of you will take extra time to complete the whole process, right? So have a map, know where it is you want to go, and have these benchmarks along the way, right? Research being, if not during the school year, but during the summer. Now, there are a number of summer programs out there that individuals can become part of. And you can go on the WMC website, you can come to our tables, and you could find out which medical schools have programs. So going back to the letter of recommendation, if you're part of a summer program and you're doing research, I urge you to be interested in whatever it is you do, all right? Because you're saying, okay, I want to do this. You have to know why it is you want to do it, okay? Also, you're going to be part of a team that's doing research. We would expect that you get a letter from the PI in the lab or someone who is conducting that research. So what do? You become interested and you're out there to help that person or that team, that group, move whatever they're studying forward, right? You should know why it is you're there. So once again, where do you get the research? It could be during the school year, it could be during the summers. If for some reason that doesn't work out, some students do take time off after college and perhaps do a program at the NIH or become involved in a longer term research project, perhaps at a medical school, perhaps someplace else. Right? But if you keep in mind the purpose of research, you're looking into environment and there's a question that is being asked and you purposefully going out and trying to get the answer, right? you would be part of a team I mentioned earlier, and you may be just doing a little part of the project that the PI is studying. It is important, as even small as it might be, or you insignificant as you may think it is. They hired you, they brought you in for a reason. It's important, right? So when asked when you're during your interview or anyone asks you, well, what do you do? Well, what's the research project about? You should be able to not only say what you do day to day, but where what you do fits into the larger picture, right? And the purpose and where it is this project is what they're doing, why they're doing it, what difference it's going to make, right? Let's see. Okay, I'm just looking through my notes. I'm going to talk about extracurricular, if that's okay. Now, extracurricular just means anything other than your classwork. And that's a huge area. And we want to know, what do you do besides class, right? You could be an athlete. How many of you are athletes in the room? There you go. All right, that's extracurricular, right? Working. There you go, right? Musicians? Any musicians? Right? Dancers? Okay. Volunteer. How many of you volunteered? So all these extracurricular activities, they matter. Why they matter? Because it matters to you, right? And these things help to keep you balanced, right? You're not just about studying the work and so on, which is very important. And I don't want to underestimate the value of high GPAs and MCATs, but it's about balance. And as you move forward, you're going to hear more and more about wellness, right? Student wellness, very important. So with those extracurriculars, you should they have their place, because that's what kind of helps you to wake up in the morning and go out and do these things and then go and really work hard in your classes, right? Nilda mentioned there are these 15 opportunities to state them. Use those opportunities to say what these extracurriculars are, and basically why you did them. And there may be 3 that you say, you know what, yeah, there's research I did. This research for about 6 months or even 3 months in a summer program, it was meaningful, and you state why. In terms of a gap year, should I go to that? Yeah, okay. Gap years, some of you, I spoke with a couple of you this morning, and you said, yeah, you'll be doing a gap year, and know why it is you're doing it. We're not going to judge why you're doing it. We're not going to say, oh, well, this is meaningful. No. You should know why it is you're doing it and explain to us. Once again, this is purposeful. Think about your path and why you're doing certain things, and just let us know. Some students may have to work to pay down some debt. It's real, okay? Some students may, once again, go to the NIH and do a year or 2 of research, get some scholarly activity in there. Teach for America is also popular. Scribing is popular, right? Getting the clinical exposure that you may not have been able to get during your school year, right? So all these things matter. They make you who you are. They make you whole, right? Keep you balanced. And just let us know, okay, what were they? Why were they important? It was mentioned earlier, Nilda mentioned this, and I just want to reiterate this. As you go through your journey, keep in mind, okay, you want to be a physician, keep the physician lens on. And you're going to see things that perhaps you may not have seen before. You may be walking down the street and you see someone homeless and it's like, wow, what sort of health care does that person get? Right? Do I have an obligation as I become a physician? What is my social stance on certain things? What are social determinants of health? What are they? You know? So I think becoming a physician is wonderful, but then it's not, to my mind, it's not just about getting the accolades and so great. My parents are very happy, my family's happy, I'm a physician, but I think there's an obligation to society that physicians have. Healthcare disparities is another thing you may want to look at, okay? So I think those are some of the things that I want to talk about in terms of extracurricular gap years, and I look forward to questions.
Those are excellent, all excellent points. I'd just like to add that I think very importantly about the things that Liz just spoke about for gap years or a gap year is really, really important as you think about the fact that you're finishing undergrad, you're going to have bills, right? So these are all paid experiences. It's important because you don't have the opportunity to just hang out for a year in a lab and volunteer because, you know, food, next research, food's gonna win, right? So these are all paid experiences. NIH, scribing, Teach for America, AmeriCorps, they're all paid experiences. They're all very different experiences, and medical schools love all of them. All right, so I think that those things are really important for you to think about.
It's an enrichment year, not a gap year.
Yeah.
Enrichment.
So how many of you are planning to take a enrichment year?
Yeah.
All right. Good.
Can I add something about that? We use the phrase transition year at Vanderbilt, but just the schematics of how this works. You graduate in May or June or whenever you guys graduate or whatever. Your application for, you're going to have a transition year would begin. The challenge is that if you are just going to have one transition year after you graduate, with the timing of the way the AMCAS works and with your inability to send updates to AMCAS and send out to all the medical schools, there's also a challenge that not many medical schools will accept additional information from an applicant after you've applied. We will, but I know a lot of my peer schools don't. So it's going to be hard for you to tell us what you're doing in your transition year. You know, if you get a job with Teach for America and you're going to be teaching at XYZ school, we might not know about it. We got to get you to the interview so you can tell us, oh, hey, by the way, I'm doing this thing. But if we don't know about it, we might pass you over because on your AMCAS application, you've got nothing planned out for your transition year. So you just want to kind of think about how medical schools are going to view that, okay? So it's totally fine to kind of trick AMCAS, if you will. Let's say you've got a job starting September 1, but you want to submit your AMCAS, June 1st or whatever. You can put the start date, and this is just kind of tricking AMCAS a little bit, put the start date of like June 1, but in the description say starting September 1st, I'll be teaching at XYZ school. My responsibilities include blah, blah, blah. Now, we aren't going to go, oh my gosh, we totally have to accept this person because they're planning on teaching in September. But it just it's kind of a placeholder, if you will. So if something changes, we're not going to hold your feet to the fire. If you end up teaching at a different school instead of the one that you put on your AMCAS or whatever. But you just have to kind of get AMCAS to do what you need it to do to tell us what you're doing in that transition year.
All right. Excellent.
If I could just add one other thing.
Yeah.
Some students do Peace Corps. They're out of the country during that period. It is fine. If you get the opportunity, grab it. Okay. But you be mindful that chances are you'll have to come back for your in-person interviews. And so you will try to put them in a period of time that maybe I see students doing around like November, December, coming back and putting their requesting, if they're going to be interviewed, to request their interviews around a particular period of time. So it's fine. Okay.
All right, so we're going to talk about interviewing. So I'll be the shallow person to just make a point. So this young man here who is actually not looking at me, yes, you. Could you stand up for me? You who are looking at him, you, yes. The young lady right beside you, you, yes, you. All right. So why did I have? Can you turn around and face the group? All right. Why did I have these folks stand up? Any idea? All right. All right. So we're going to be talking about the interview. All right. So medicine is a very traditional still. There is certainly room for self-expression. I would suggest that your interview is not the time to express yourself, right? Individuality can come when you're in medical school. And actually, I'm sorry, you guys, you can sit down. Thank you. And actually, I tell my students when they're in medical school that actually they can actually wait until after residency, right? And then when they are board certified, right? Whatever you want to do, I'm good with that, right? But until then, relax. So we've heard from Debbie. We haven't heard from Jonathan. So I'm putting him on the spot
All
here.
right.
He doesn't have a choice. He's going to talk us through the interview with Debbie.
Okay. So you've applied. You submitted your application. It's complete. You got under review. Now you got an invitation to come in for an interview. And really, the interview is an opportunity for medical schools to get to know you better, to get to know who you are, to hear your voice, and to get to know you a little bit better to see if you're a right fit for their institution. Now, there are a wide variety of different types of interviews that medical schools use, and everyone's different. Sometimes you can go to websites and they'll be pretty transparent. You can read through their websites and you'll know exactly what to expect. And sometimes they don't. They do sometimes that deliberately. So you'll see things like, so for instance, PCOM, we just do a panel interview. If you go in by yourself and it's an open file interview, meaning everything you've sent to us is in the room for us to review and to talk about. Some schools may do what's called a blind interview. Means you may go into an interview and who you're interviewing with has no idea about your application. They probably just know your name and that's about it. They don't know your MCAT score. They don't know your GPA, what your experiences are, what are your letters, what great things people had to say about it. They have no idea. They're just here to talk to you. So it could be a panel interview. It could also be a group interview. Sometimes they may have you interact with other interviewees of the day, maybe with a facilitator. They may do something what's called a mini interview. Also, some people like to call it speed dating for medical school. You'll go in, you may go into a room, the person may have one question for you, and then you'll respond for about 5 minutes, and then move to another room, another question with another person. That's another modality. Some do a standardized patient experience. I have heard that several medical schools are doing that, where they may have you interact with the standardized patient with the assumption that obviously you're not even in medical school yet, so there's a tempered expectation of how you'll interact with them, but they try to parse different things out through that experience. So you'll see a wide variety of types of interviews, and really they're just trying to get to know you better. And at this point, as you'll hear from numbers when you talk to tables today, there's a big pool of people, but medical schools only usually bring in a small portion in for an interview. They reviewed what they've liked on paper. They saw something they liked on paper, and they bring in a smaller group to interview to then craft their class for the entering class. So some of the advice I can give students, one of them has already been pointed out, you want to dress appropriately for your interview. So jeans, sneakers, t-shirts, albeit maybe go out with friends, maybe go to class, it's okay, but not for a medical school interview. Professional attire is expected at a professional school interview. Now, if you're not sure what to wear, I would always encourage you to reach out to your advisors, reach out to faculty members, your parents. I have an interview coming up. This is what I'm thinking about wearing. What do you think? So you can run it by some people to see if it's appropriate for you. Now, no one is expecting, I don't think anybody's expecting the $5,000 Armani suit or anything like that. A simple suit will be more than sufficient. It does not have to be extravagant by any means. I've had students tell me, I want to stand out. I want people to remember me when I leave that room or leave that interview day experience. I want them to remember me. So I want to wear something that they're not going to forget me. I say, be careful. Tread lightly. You always want to walk away from an interview with people remembering you in a positive manner, not in a negative manner. So please be careful if you decide you want to wear something that makes you stand out, so people won't forget you. You want to. I've been at PCM 12 years, and I can tell you, I always remember the ones that were not dressed appropriately, not the ones that were. If you dress appropriately, I'm probably not going to remember it, but I can remember at the top of my head all the students that were dressed inappropriately. And I know exactly what they were wearing too. So that's how you can stand out. Other than that, I tell students, again, you're in a small pool of students. They saw what they liked. They read your application and they liked you on paper. So they want to get to know you better. So take a big, deep breath and relax for your interview. Go over that right before you go into your interview. Like, yeah, I'm in a small pool. They really did like something on paper. Now I just need to talk to them and explain why I am choosing this profession and why I'm interested in that particular college and university. With that being said, the night before, the days leading up to your interview, reread your application. Remember everything you wrote, your personal statement, everything that's on your application. Be prepared to talk about any aspect of it, especially if it is an open file review. If it's blind, they may not necessarily go into it, but especially if it's open file. And even if it's not open file, they're still going to ask questions that are centered around your application. So remember, told me I didn't write that. And I looked at it and I had to verify and say, what's your name, your date of birth, your address. I want to make sure I got the right application. I want to make sure I wasn't making a mistake. Like, did I read the wrong one? And it was right. It was the right person. He just did not remember what he had wrote on his application. And what does that tell you? It tells me the person was not prepared for their interview. How are they taking this interview process seriously? And if they're not taking it seriously, why should we take them seriously as a coveted spot in the medical school class? Why should we take them seriously? So I encourage you to go over, and that goes for any interview. That doesn't have to be medical school. It could be a job interview, an internship interview. Doesn't matter. You want to make sure you go in prepared and ready to talk about any aspect of it. Other advice, sometimes, sometimes there's hiccups in your academics. A semester didn't go well, a grade didn't go well. Sometimes they may, especially if it's open file, they may ask about it and say, what happened? The worst thing you can do, I think you're all looking at me, you probably know what it is. Do not blame the professor. And these are things I've heard in the past. Take ownership of it. If there's a shortcoming in your academics, what did you learn from the course? Even if the grade does not reflect that you didn't do so hot, but you probably did learn something. What went wrong then? If you didn't do well, what happened? And did you learn from your mistakes? Did you grow? And moving forward, you've gotten better. But definitely do not blame the professor. Chances are you're interviewing with faculty. The last thing you want to do is blame other faculty members. That's not a good thing. Debbie, you want to?
Sure. Just a point about the dress. Wear something comfortable. If it's a brand new outfit, wear it a couple days beforehand, particularly the shoes. Ladies, I don't know how you walk in these 4-inch planks, but likely you're going to be taking tours. So you want to be in comfortable shoes and just feel comfortable physically, so that's one less thing to worry about. Also, with the interview, you got to think of it as starting maybe the day you get off the plane or the bus or whatever. Be courteous to hotel staff, be courteous to that receptionist who greets you, security folks. These are things that people are being observant. And one of the biggest things we want to know is, are you a good fit for our school? You want to be yourself, but you want to be your professional self. Okay, so practice. If you get a chance to do mock interviews, take advantage of it. It's really a good idea. What else?
So with back to dress, make sure it's comfortable, make sure it's well tailored. Sometimes students borrow maybe a suit from maybe a family member or a roommate or a friend, but make sure you're actually of a similar height and size. Sometimes suits get a little snug, or you're overflowing the suit and you're falling out of it because it's not, obviously the suit was not made for you. So you want to make sure that you feel comfortable. The suit, the material fits well on you, so you can have a comfortable day in the process. So just be careful of that.
Put the cell phone away.
Yes.
I cannot tell you enough that you want to be fully engaged in this process. So you don't even want to have it out, and you don't want it ringing during the interview either.
When you walk onto campus, turn it off.
Yeah.
For the rest of the day until you walk off campus. That's the safest way to go. That way it won't just randomly ring, or you'll get a text message or something. Just turn it off, and when you walk off campus, you can turn it back on and tell everybody how well you did.
Nilda, quickly.
Yeah, so because you're going to be applying to 12 to 16 or more medical schools, and sometimes the schools all sort of mesh together. So at least the day before, the night before, go on that website and familiarize yourself with that school. You should have questions, and even if it's the same questions you asked at each medical school, or you've asked 3 people on that campus, because people say, I have no questions. No, it's okay. It doesn't seem like you're that engaged or curious about your curriculum, lifestyles, and so forth. And the last tip in terms of maybe saving money, some of our schools provide you an option to spend the night before with a medical student. We give little perks to the students, the medical students that host someone overnight. It helps with you, saving a hotel night. But it also gives you insights. You can talk to that person as to what is their experience. And evidently, if we're selecting them for them to host you overnight, it's not someone who's, upset about the school, or typically they're not. It also, they give you insights. They may even, accompany you to admissions, and they say, listen, here's a shortcut. I'm going to take you directly to the room you have to go. You don't have to walk 3 blocks that way, or whatever. So that's another way to maybe cut down on your costs to see if you be hosted overnight.
All right, really quickly,
Really
Liz.
quickly. You could be interviewed by a medical student, an administrator, a basic science faculty member, or a clinical science faculty member. Keep in mind that each is going to give an assessment of their interaction with you. And where I am at Weill Cornell, each person, the evaluations are weighted the same. Okay, it's not because you're a medical student that it won't matter. Medical students can be a little tougher, if I may, right?
Yeah,
they can be a little tougher. So just don't be too comfortable. They may be maybe your same ages, or maybe a year or so older than you, but keep it professional. Don't be too comfortable where it gets to the point of, they may feel disrespected.
All right, really quickly. So Jennifer, if you can just run us through postbacks.
Postbacks, they exist. We like them. So if you cannot afford a formal postback program, take extra science classes. We're fine with that. At Vanderbilt, we don't care. There are some postback programs that have articulations with the medical to do well. In the postback program, you'll get an automatic interview at the medical school. That might be something for you to look at. If you Google AAMC postback, you'll come up with a menu and you can kind of search from there. I personally would not recommend doing a master's in public health or nutrition as a grade enhancer. So if your grades aren't where they need to be, and that's why you're doing postback, those classes or programs unfortunately don't focus on the sciences that we like to see. But if you love nutrition and you have great grades, it's totally fine to do a master's in nutrition. So don't hear me wrong, or public health or whatever. But if your sole purpose after you graduate to do postback or master's degree to increase your grades, I would steer away from public health or nutrition.
All right, excellent. So just one quick thing. So the New York medical schools, some of them are all involved in a postback program. through Associated Medical Schools of New York, which is kind of the umbrella program for medical schools in New York State. So 8 of those schools have a post-bac program that is actually based up in Buffalo. So again, you can't apply to this program, but what happens is you apply to medical school, the medical school admissions committee will make the decision that you're a student who you have the potential, they can see that, but you're not quite yet, they don't think ready. So they will send you up, in this case to Buffalo, for a year of a little bit more of a robust experience in terms of courses to get some study skills, etc., to get prepped. And then after that year, you actually have a conditional acceptance to go back to the medical school that referred you. All right, so that's just something for you to
And
know
how much
about.
does it cost?
Costs nothing. Buffalo fits. Buffalo actually pays the tuition, and the Associated Medical Schools of New York team actually gives you a stipend because you're not allowed to work. So it's for those people who obviously have all of the abilities, but because of life have had to do other things as well. So we want to see how that works when you don't have any of those things that you have to worry about. Again, you cannot apply to that program. You have to go through medical school admissions, and then the admissions committee makes that decision as to who to refer to the program. All right, good. We have a little bit of time for some questions. I know you guys have a lot of questions. So can I see some hands for questions? All right, good start. So can you keep those hands up? Sorry. All right, so take a look at me because I'm not going to remember this. 1, 2, 3, 4, 5, 6. All right, so at least I'll remember 1. All right.
Could you stand up and introduce yourself?
Right.
We want to be able to hear you.
How do you guys look at this, for instance, you taking the MCAT, it's been a year since you've taken it, to like the time you're going to matriculate, does that affect your decisions? Like, whether or not that's one of the interactions?
Ryan, what are you, as the MCAT guy, what are you?
Well, I mean, I don't know if it's like this to every school, but we will accept an MCAT if you've taken it within 3 years of matriculation. So, you know, if it's been 2.5 years, that's fine. We're not going to, you know, critique you too bad about that. So if it's been 5, 6, 7 years, yeah, you probably need to retake that test because you probably.
My question is regarding the extracurricular team activities. For people who've done, like, say, 5 research or a bunch of information trips, can we group these into the section, maybe like right now, sort of looks like every single thing?
Yeah, because you're gonna have to identify each one by dates. What was it called? Who was the coordinator, supervisor, and then a description.
Okay, so I guess you're saying pick the best one.
Absolutely.
Actually, I would disagree with that. Just because what I would recommend you do is make a laundry list of everything you've accomplished since you graduated from high school. You may have to lump some things together. If you've got 28 things that you want to tell medical schools about, you might highlight this one medical mission trip because you were there for a month and it was amazing, but you might have to lump the one-day ones all together. I mean, you have to do AMCAS like you have to do MCAS, you know, that's the thing. But I would say for us, we convert all of your extracurriculars into a timeline. So if we notice like there's a large gap of time, like nothing listed sophomore year of college, we're going to be like, what's up with that? And sometimes people don't list things like, oh, well, that's the year that I had to work and wait tables at the Olive Garden, so med schools don't care about that. Yeah, we do. So put that on there. So you have to do what you have to do in MCAS. 15 max.
Thank you.
All right, number 3.
Hi, my name is Christian Barbachi. I'm from St. John's University. Thank you for taking the time out to speak today. My question is regarding the post-bac. So I want to say about the GPA for the post-bac. You said that it's a conditional interview if you have a higher bar. How does the undergrad GPA get weighted along with post-bac? And is there more lenience to the post-bac, or is it if you have a low enough GPA for your undergrad, is that also just another red flag? Is it not like really weighted for for the latest classes.
So Christian, I think you put a couple of things together.
Yeah, what I'm saying is like,
So post-bac is after undergrad, right? Right. So in the Buffalo program, we, as I said, it's not a program that you can apply to, right? So, and then because you have a conditional acceptance, if you meet the grade requirements for that year, you don't have to go back and apply to medical school again. You already have a conditional acceptance, right? So that's one. I think the other part of your question is, how does a post-bac program in general affect, or how is that compiled with regards to your undergraduate grades? Right. So I'll let someone else handle that.
So, from our standpoint, we look at everything together, but we're also looking at trends. So I know for myself, when I look at the student's application and I can see that they've also done a post-bac program, I try to tie in what the timeline was, what was happening when, to identify where their strengths were or what was happening while they were in classes. So we look at everything, but again, I can only speak for myself. I'll also look at the post-bac separately to identify if you've done better from that standpoint, especially if it's been a while since, going from undergrad into a post-bac or a graduate program, if there's been some maturity there, because you can kind of see. So, from the way that a student does their classes from freshman to their senior year, they had a couple years break, they went back and did a post-bac program or a master's program, and they're, hitting all A's. For myself, I can see that there's been growth from that student from an academic standpoint. And so it makes a difference to be able to then see where the trends are, especially where your BCPM is concerned.
I wanted to address that question because I think sometimes a student will do a post-bac program because they need to improve their grades, obviously, but whatever caused your grades to be not so strong undergrad, you don't want to repeat in the post-bac. That's really your second opportunity, and in many cases, your last opportunity to demonstrate that you have this academic ability. Because the issue is, are the courses in the foundational science courses strong enough to support a med school curriculum? And so whatever we're doing, whether it's maybe too much extracurricular, whether it was working, you've got to make decisions about the post-bac, because now it really does matter. So I would tell students when they come to me and say, what should I do? I'm like, if you're doing a post-bac or master's, you need an A. Get A's, because you can do it, but you have to rethink how you're going to plan your courses and how you're going to do this. Some post-bacs are very structured. So, some post-bacs are more lenient with putting your courses together. But whatever that process is, you need an A. And you need to be in a position to demonstrate what's changed and how you've improved and enhanced your academic ability and maybe even the level of maturity that it took to get through that post-bac. So I do tell students, make sure if you're going to do it, do well.
Yes. All right, good. Number 4.
Hello, my name is Giorgio Maloof, and I had a question for, I guess, everyone on the board. What kind of diversity do you look to add to your particular med school? Because I know everyone has a different profile and a different type of position that they're trying to train. So I'm just wondering, are you trying to get physicians that are more research inclined? Are they teachers? Are they community activists? What's the particular profile of your individual medical schools?
So, you just asked 14 questions, right? No, go ahead. So I'll let, why don't we have, a couple of people take a stab at that, so.
All of the above. Seriously, we take people, like the oldest person in our current first year class is 40 years old, a man from California who's married. We want people, community activists. We give a social justice award at graduation. We want academic people to become faculty, and especially faculty from individuals from underrepresented groups. We want excellent clinicians. Some of you know Dr. Holden and Dr. Robles, so it's all the above.
Mhm.
LGBT, you name it, we want it.
Same.
Yeah. Yeah.
Check. Same.
Yeah.
I think, what we've learned over the years is that the diversity in all of its components helps to create excellence,
Yes.
right? And so a part of what we do, you've heard people use terms like fashion a class, right? And that means that we don't need a 527 and a 4.0 for you to be a great doctor. What we want are people who are scientists, community activists, all different people to come in, people from urban and rural areas, people who have had challenges, people who have struggled with disabilities. All of those people come together in a class and they learn from each other, right? And that's how we all get more competent culturally. That's how we all understand how to deal with people who are different from us, right? And those are the things that we look for as we try to fashion a class, right? So, so great question. You're 4?
Cool. Yeah.
I was four.
All right, 5?
Hi, my name is Brandon Friedman. I go to the College of Staten Island. I'm a senior. I actually have 2 questions. One is a public question, the other is a personal question, but I can tell it, it's just in relation to.
That's fine. As long as you're comfortable, we're good. As long as you want to share with the world, we're good.
Well, my first question is, how do you view people who have experience in the medical field already working at a job? And would you view somebody who's worked at like a medical office, medical assistant versus a scribe the same way? And how would you view them differently? And jobs with like relations to that?
There's no difference.
No?
No, we look for individuals who have investigated the field of medicine. And that can come from different areas. So, because keep in mind, you want to become a physician. How do you know? Right? So you want to be in the environment, to hear the sounds, to smell the smells, to get a sense of the team and how doctors interact with other members of the team and vice versa. So there's no difference.
And the second question is in regards to this personal question. I've been doing research for over a year now, and I'm working to get a publication. And this summer, I decided to take my MCAT in August. So my question is, I have conflictions now because I have the option of either going to another country and continuing my research while studying for my MCAT, or I can stay here and continue to work and volunteer and study for my MCAT. Which do you think would be a better option?
Where are you gonna get the study for your MCAT class?
Wherever.
At either location, I would be in a home environment because the country that I would go to, I have family there and I can stay with them. So either that or I stay here at home instead.
And then the choices are research or volunteer?
Or and work, because I'm not medical assistant also.
Okay. But you've done medical assistant stuff already?
Yeah.
And you've volunteered already?
Yeah.
But you're trying to get that publication?
Well, it's already in the works. It would
Well, you
just
just
be
need to
beyond
finish
the
it.
publication.
Right. I mean, it sounds to me like your research is
Important.
yeah.
I'm just worried I won't get enough study for my.
That's why I asked you. That's my first question.
So it would be like I would be like a full-time job.
So that's what I'm saying. You have to figure out if you're able to study for your MCAT, because that's your priority, right? So if that means you're going to get more study done here or work less than at home, and your MCAT is actually a priority. That's why I asked where you're going to get more work done studying for you.
want it, but only you know for yourself what it is that you really want to do. And just by listening to you, I feel like the research piece keeps rising to the top for you. So if you're looking for a sign, there it is.
All right, thank you. Number 6.
Hello, good morning. My name is Asma Zia. I'm a senior at Buffalo State College. So I did have a question for you guys. I know for most medical schools, 3.7 and above is like the requirement to apply. Most of them that I did research. So I would say, when is it like a concern if you have like a 3.5 or below?
I think that's a great question, right? It's one of the things. Again, it's one of the things that we try to put out there for you guys. I see Jen.
I'd like to address that because Vanderbilt has very high academic standards. So we talk a lot about a median, but I really would encourage you to look at our range. So our range in our class is a 3.0 to a 4.0. So pay attention to that. But we really do look at performance trends. I mean, if you're coming into us as a 3.7, but it's because 3.5, it's because you had a 2.0 your freshman year and you worked all the way up. Yay, we're proud of you. You've done a lot of hard work. Congratulations. Let's reward that. As opposed to, you peaked as an 18-year-old freshman and you've gone downhill after that, So a 3.5 or a 3.3 or whatever, it all is in context.
And that range is important, right? What you're saying is that there's somebody in our class that has a GPA of a 3.0, right?
Mm-hmm.
So it's not just the average of 3.7, 3.8, right? So yeah, look at that range. All right. We actually have time for one more. All right.
Oh, he raised his hand so fast back there.
All
I
right.
feel like it's
So
rewarding.
we'll do 2. All right. Why don't you go first?
Say you finished college, you graduated, and say that you missed one of the prerequisites, so you just take it over at a community college. Is there like a stigma towards that or any like negativity towards that if you would take it?
We're fine.
So Steve, the only thing that I'd say is you put that all in context, right? As you go through college, hopefully I'm not going to make any money here, but as you go through college, we like to see that at your primary college, you've done at least one semester, maybe possibly 2, during that sophomore year, where you've actually done 12 to 16 credits of solid science work, right? Because that's what you're going to be doing in medical school. So if every semester all you've done is 1 chemistry and then badminton, right? And then so that's really hard for us to judge if you're going to be able to do this in medical school. So in that sophomore year where people are doing a little bit of calculus, a little bit of organic, and a little bit of physics, that's a solid semester. And we like to see that you've been able to struggle with that, do well, so we can get a sense that you're actually ready for this, right? So I think that's important. Our last question.
Hi guys, my name is Saima. I'm a recent graduate from City College. My question was from Steve. You mentioned how all of you see the trend of students who possibly did, not that great in their freshman year, but had an upward trend. But how do you assess students who had an upward trend starting from the beginning of their college career, but had a semester or 2 where they had a downfall because of whatever reason, but also were able to pick back up and had an upward trend? How do you assess students?
The MCAT has been a great equalizer. So whether we like the MCAT or not, it is what it is. So that takes care of those educational differences from somebody who went to quote unquote an easy school or a hard school or had a, low grades because they were working full time or whatever the case may be. So we really do triangulate your profile, like your grades, your coursework and things like that with your MCAT performance with your letters of recommendation.
So as moderator, I'm going to take the privilege to wrap up, right? So first of all, thank you guys for coming today. I hope that you understand that what we're trying to tell you here is that you don't need to be perfect, right? But that being said, this is hard work, and we need to see that that has happened. It's hard to start college, not understand the process, come in, try to do 16, 18 credits because you were a star in high school, and realize that you hit a road block or a bump in the road. But you have to recover. We want to see that overcoming adversity, those trends that you've heard over and over again, that you've figured it out. So that by senior year, it shows that you can do this and you understand where you are. The second point I want to make is that you all need to mentor each other. You've gotten information from us, and we'll always be here to provide that information for you. This wasn't about coming to our schools. This was about providing you the information. We can tell you that you need to do X, Y, and Z and how that needs to happen. But guess what? The juniors can say to you, you cannot do Jennifer's section of organic. She's a horrible teacher, right? Stay away from that, right? You should do Liz's section of organic because she's an amazing teacher, right? And she's, you know, she's not a worldwide researcher, but as an organic teacher, she makes this stuff seem so easy. We don't know that. You guys know that. Which section works and who is able to help you and who is gonna make this more difficult than it needs to be, right? So you need to mentor each other from year to year. This is not an individual sport, right? So you need to find your peers who are doing the same things that you are doing and make sure that instead of somebody saying to you on Friday night, hey, let's go X, right? It's okay to do that on Tuesday night after the organic test, right? So you just need to make sure that you have those people around you who are going to support you at all levels, all right? We're going to be here for the fair, so feel free to come up and talk to all of us regarding this.
And I have at my table a bookmark put out by the AAMC. In one site, you'll have the information about AMCAS, MCAT, the fee assistance, the MEMAR, the MSAR, summer programs, all in one thing put out by the AAMC.
Right.
So
It's
you-
an amazing website, you know, aspiring docs. You guys need to, it needs to be one of your bookmarks on your computer. You need to go there for both allopathic and osteopathic programs. So to my colleagues, thank you all so much. And I have been instructed to tell you all to head down to the Great Hall and that you'll know where that is, right? All right, thanks a lot, everyone.
Great job. You kept us on time.
Well, I think it might be because when I tuned in, at like 9, it was like, oh.